They're obsessed with the sport of politics. And so that's the environment in which elected officials are operating.
President Obama today making a spirited campaign-style appeal for long-stalled health care reform. In his words, this as Democratic congressional leaders work behind the scenes on legislation they hope can quickly gain some passage. The president's pitch was part of, well, ripping insurance companies and part taking on his Republican naysayers.
We talked about it during Democratic administrations and Republican administrations. I got all my Republican colleagues out there saying, well, no, we want to focus on things like cost. You had 10 years. What happened?
White House is pushing to have a health care overhaul bill wrapped up perhaps in a week and a half. Republican Congressman Peter Roskam, Illinois 6th District, here tonight to put some Republican perspective on this. Okay, let's take the president's last words there. Republicans had power for 10 years. Now the Republican mantra is, no, the people want us to start over on this health care reform. Why didn't anybody start over for 10 years?
Well, I think that's a fair observation. Look, I'm not going to be defensive about past opportunities that have been lost. There was some good things that happened in terms of expanding prescription drug coverage and making an attempt at medical liability reform and even the welfare reform efforts. But I think where the American public is now, Mark, is they want us to look forward. And with all due respect to President Obama, he has given speech after speech after speech and narrative after narrative, joint session speech and so forth. And the American public has heard his proposal, and they were very open-minded about it. But the more they've heard, the more they felt like, you know what, this is not connecting with where I am. The public wants Congress to lower costs, increase access, and deal with pre-existing conditions, not do this massive overhaul. So I think the president is missing an opportunity, and I think most folks say, look, do some incremental changes. Come in and do it bit by bit.
On the Republican side, it appears that polls have said, okay, we get what you're saying right now about our disdain for what the president might be saying about health care, but on the Republican side, we're sick and tired of hearing no, without any major ideas. In your perfect world, what would Peter Roskam say we should do for health care reform?
First and foremost, we should allow the purchase of cross-state lines of health insurance. That brings costs down. Barack Obama believes that. He has said that in the health care summit. I say, let's do that tomorrow.
Create competition.
Yeah, that's it exactly. Allow small businesses to pool together to negotiate a better deal vis-a-vis insurance carriers. Change the rules on medical liability so that physicians don't have to practice defensive medicine. The irony is the president has created a bipartisan bill insofar as there's bipartisan opposition to his bill. That's the only thing really bipartisan about the bill. And I think the president has given lip service, in my view, and even at the health care summit that I attended, it's given lip service to Republican ideas, but it's not incorporated into the mainstay of his bill. And I think this is where the public is looking at Washington, D.C., and they're saying, look, you can do better than this, and we want to see something better than this.
Last question. The healthcare industry spokesperson today, actually the insurance industry, when the president took a jab at it, said the president is unfairly blaming the insurance industry that 1 cent of every dollar in healthcare costs is profit for us. Do you believe that?
Well, I think that the irony is that President Obama's bill, which creates a health care mandate, is a great benefit to the very insurance industry that he's been critical of. Health stocks went up when the Senate bill passed. So I think the public says, look, start over, do it bit by bit, and go after cost, increase access, and deal with pre-existing conditions. But don't do this massive spending approach.
Congressman Peter Roskam, thank you very much for joining us. Appreciate it.